Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms. And every month this year, we have brought you a healthcare video from UTMB Health, our preferred provider for the Bay Area, Galveston, League City, Clear Lake, Pearland, that whole crew down there. And we want to, every month, give you great information of the hot topics y'all want to know about. And we have gone through this entire year. If you haven't seen the videos, they are all in our archives. Make sure you dive into those. And I'll post a link with all the videos in case you've missed them. We have touched on everything from heart health to adolescent gynecology health and pediatrician visits and well visits, all of that. Today, we were diving into something that is top of mind for all of this the past 2 years almost, and that is COVID. And today we are going to talk about the COVID vaccine being available for the age group 5 to 11, what that means, what current trends we're seeing in pediatric COVID cases, as well as what kind of shots are available for that age group, side effects, all of your pressing questions. We'll be covering them here. And today I am thrilled to have Dr. Elizabeth Rodriguez Lien joining us, and she is going to share all of those things, and we are going to get straight into the questions. Thank you so much for being here.
Yes, wonderful to be here. I'm very excited to be talking about this. I think it's, like you mentioned, a very pressing topic and one that people are interested in knowing about. So yeah, let's dive in.
Let's dive in. And before we do that, we were chatting before. You are a mom too, right?
I am a mom. I am a mom of 2 kiddos. I have my son who is 6 years old. He's in 1st grade. And my daughter is 4 years old. So she'll be starting kindergarten next year. And so my house is really fun. We are constantly trying to juggle school-related activities, daycare, trying to do some extracurriculars. And so, and I'm kind of right in the middle of the cusp of, one kiddo being eligible, and we'll talk about that. And then one kiddo who is almost eligible will be in February. And so, yeah, I am a mom who is right in the thick of this particular age group.
And I love that. I love when we have moms on here who are also healthcare providers, because our hearts, right? The mama heart. And then you can also speak to the healthcare provider heart and what y'all are finding out through your research, and as things continually are evolving. And we love that UTMB stays on top of all of that. So tell us what you are seeing currently in the COVID world as it relates to pediatrics.
Yeah, I think overall, COVID has not hit pediatric patients as hard as it has hit adults in general. I think there are a few different factors that have kind of come into play for that. At the very start of the pandemic, everybody was nestled in their own homes. We weren't going out much. Kids were being removed from schools, thinking about virtual versus not. And so, when we first saw this pandemic, children were a very small percentage of the kiddos that were, or of the individuals that were affected. They were really less than 5% of the cases. But as we have evolved over time through this pandemic, we are seeing that kids are becoming a larger proportion of the cases. Up until now, they're actually a quarter. They're 25% of the cases that are being diagnosed. Fortunately, most of the time, kiddos do pretty well with the infection itself. Most of the time, just like in adults, it can be, cough, congestion, runny nose, sore throat, feeling tired, headache, loss of taste and smell, all of those symptoms that you've been hearing about. But what is more scary is really the fact that we really don't know which kiddos are going to have that more severe type of clinical picture where it does require hospitalization, where we have seen kids in the ICU, and we have seen kids die from COVID. And so that's really the piece that we have to also be very aware of, because while most kids do well, there are some kids who don't. And it's kind of like the flu in that sense. You don't know which kid is actually going to get very, very sick and which kid is going to do okay. And so, overall, we are seeing more infections within the childhood population.
Okay, good oversight there. So we know that they've approved 5 to 11s, and we've had 12 and up for a little bit. People come into your office, their ages 5 to 11. What are you telling them?
Yeah, I mean, I tell them, if they're there for their checkup, we're due for, particularly for 11-year-olds, they're always due for their tetanus booster, they're due for their meningitis vaccine, they're due for their HPV vaccine, and you're due for your COVID vaccine. It's just part of the visit. And you're due actually right now, because we're in December, we're also due for our flu vaccine. So we can't forget that one as well. And so, it's just part of the conversation. And really it's important for me as a provider to kind of connect with each individual parent to see where they are in that decision process, and for me to guide them if they have any particular questions or concerns. But yes, it is part of the normal visit at this point. Mm-hmm.
So I'm going to go back to how you talk to parents, but right now, 5 and up, what vaccine provider is doing that? What vaccines are they getting?
So 5 and up, I would say, 5 to 11 and 12 to 18, the only vaccine that's approved for those age groups is the Pfizer vaccine, which is an mRNA-based vaccine, but that is the only one. Yes.
Okay. And can you kind of speak to the dosages that the younger population gets as opposed to the older?
Right. So the 5 to 11 age group, it's actually only 1/3 of the dose of the older as compared to the older children. So 12 to 18 and obviously adult age groups are getting what we would call like a full dose. And then the 5 to 11 age group is getting 1/3 of that. So there is a bit of a difference in that sense.
Okay. And are they doing it in 2 shots like we did
Yes. So it does follow the same schedule in that you would get your first dose on the day of your visit, and then you get your second dose about at least 21 days after that. Mm-hmm.
Okay. And I'm going to go off script here for a second because I have a question. I have 2 11-year-olds and they do not come from the biggest stock. We are not big people. And so when they turn 12, which won't be until June, but what is the recommended dose for maybe an undersized? I mean, they're on the chart, but do you know what I mean? For an undersized 12-year-old, they're not taking the same amount of Tylenol as like an 18-year-old.
Right. Well, I think that we have to realize that in vaccine research, we have to make some sort of age cutoff, and sometimes that can become an arbitrary process. And so, for these particular trials, that was the age group that they chose. 5 to 11, 12 to 18. Okay. And while I understand the motivation behind the question, really on average, 12 to 18-year-olds are becoming more, I guess, adult-like in some ways. It's kind of
all their hormones and all that.
Right. And so really regardless of whether they are on the 5th percentile for weight or the 99th percentile for weight, all of the children that were included in those trials, which was representative of a general demographic, did fine with that particular dose. Okay. Really with this smaller smaller dose, it's really just due to the fact that these kids are honestly much younger than an adult population.
Got it. Well, thank you for jumping off script there. But I think, we always have questions as parents, right?
Yeah, no, absolutely.
And that may not be the only person who has that. So what kind of side effects are you seeing in the 5 to 11 age group as they're getting their COVID vaccines?
Yeah, it's really the same as all of the other different age groups. And so most common things are, common to pretty much any vaccine. So it's possible that you're gonna have fever, redness or soreness at the injection site. You can get a little inflammatory reaction there. And so, Tylenol or Motrin, just kind of the way you hear your pediatrician talk about it all the time. If you have, pain at the injection site or fever. I think that the side effect that most parents or some parents that I've talked to that are concerned about is this myocarditis side effect that they've been hearing about. Okay. And I'm sure that was probably your next question. But so myocarditis, for those of you who may not be aware, is inflammation of the heart. And they did see that as a very rare, and I cannot emphasize that enough, very, very rare side effect of the vaccine in teens and young adults, most commonly occurring in an age group of between 16 to 25, I believe. That's mid-20s around there. And almost all of the cases just kind of resolved on their own. If they needed medication, it was basically an anti-inflammatory like Motrin. And when this first started, we were very much aware of, the potential seriousness of this. And so there were some individuals who were hospitalized overnight just to watch them. But again, really the only intervention that was needed was Motrin. And so when parents ask me, I'm concerned because I don't want my kid to get myocarditis. And I understand that is a legitimate concern. I have to also remind them about what the risk of myocarditis is if your child actually contracts COVID, because it's actually much higher. When you look at that particular group of 16 to 25-ish year olds, if you took 100,000 people, and to kind of put that into context, NRG only holds about 72,000 people. So if you filled NRG 1.5 times essentially, for the males 16 to 29, and again, this is the most frequent age group that this occurs in, with the vaccine, you have a chance of about 5 in 100,000. So 5 individuals in about 100,000. If you actually acquire COVID, that goes up to 59 in those 100,000 people. And kind of looking at the females or the girls, the risk of myocarditis with the vaccine is 1 in 100,000. And with actually acquiring COVID, it goes up to 39 in 100,000. So, I think that we have to weigh, what are these actual risks? Because to be honest, the risk of not vaccinating and actually acquiring COVID actually outweighs the risk of that happening with the vaccination. So I think that's an important thing to kind of discuss with our parents. I'm a numbers person. Numbers don't lie to me. So I am very much a numbers person. And if you can give me evidence and you can give me numbers that I feel like weighs so much more than, anecdotal kind of information. So, yeah.
An important point, anecdotal doesn't mean that it's been peer studied and all of that. So, and also for someone, I'm not a numbers, I don't process numbers well. I'm not an engineer like my husband, but so thank you for all of us who are challenged on numbers of putting it into NRG, because that I can picture. The rest of it's kind of beyond my scope, but I do have a daughter who has a congenital heart defect and has had 2 open heart surgeries. And so obviously, myocarditis we don't want to irritate the heart, but she had COVID, her heart blissfully did fine. But, it's just, those are really good points to make that, typically what we're saying is your risk of having myocarditis if you get COVID is higher than if you get the vaccine. So good points there. So coming down to numbers, since you're a numbers person, and then maybe how you speak to parents who are like me. I have 2 11-year-olds, so we're eligible. How are we talking to parents, and what are you telling those parents who are on the fence about getting the vaccine? Because at least what I'm seeing in my peer groups and mom groups and what have you is, things have, it feels like it chilled out. We went through a pretty high point, I would say like August and September. Felt like, I'm assuming what was the Delta variant burned through our neighborhood in school. But now it kind of seems like, okay, I feel like I want to give this more time. What are you telling to those parents?
Yeah, I feel like most of the time we can say time is on our side. And I feel like in this case, however, it's not, because, I think, as you mentioned, we were chatting before, and now we're hearing about this Omicron variant. And so I think regardless of kind of these ups and downs, really the only way that we have survived as a human race in actually eradicating a disease is through vaccination. That is the only way that we've actually been able to get rid of infections. If you look at polio, if you look at measles for the most part, but that's a whole other topic. Public health measures, I completely I'm very for that. Absolutely. Hand washing is so important. Wearing your mask, physical distancing, all of that is so important and a vital piece of kind of getting us to where we need to be. But really, without vaccination, we can only go so far, because inevitably there will be more transmissible. There are transmissible cases that continue to be. Continue to arise. And so really the only way that we can, as a human race, really kind of get rid of this completely, and really completely is going to be a really hard thing to do, because that would involve a very high percentage of individuals who would vaccinate. But in any case, I think the more people that do get vaccinated, the better it will be. But I think that, like, you're right. At this point, even throughout the Thanksgiving holiday, I was thinking, wow, this is so nice. I feel like we're finally making some headway, and then bam, now we have this new variant that is coming out. And so I feel like, again, I just emphasize so much to the parents that I talk with, that this is really our ticket out. And sometimes it's hard to really see past the here and now. Right. And kind of figuring out, am I okay with this decision? And that's what I'm there for, is to really just guide them through that decision in whatever way I can.
And that's something that we always stress on these videos, whatever kind of specialists we have on here. It always comes back to your relationship with your pediatrician or your primary care physician, and just making sure that you have that relationship established, so you can go there and be like, I have questions, I have concerns, let's talk through it. And I think UTMB does such a great job of providing those open conversations. And I think if you do not have a primary care or a pediatrician that you feel like you can openly have those conversations, especially if something as important as this, you need to find one. We're going to pop a link also for how to find a primary care pediatrician at UTMB. And I think, doctor, like, coming back to, I feel like moms have decision fatigue, like decision health fatigue. Yeah. We feel very tired from having to make the decision of, do we school? Do we stay home? Are we masking? Are we not masking? Are we doing this? Are we going to grandma's? Like, what would you say to the mom who's just tired of making one more healthcare decision? And it's not from an ignorance standpoint. It's just, we are tired.
Yeah, I would say I feel you, honestly, because I go through the same thing. We had to we had to think about whether we were going to send our son to school versus doing virtual. Are we going to get together for Thanksgiving? And, I think that while it is a personal decision, it is also something that is an individual and collaborative decision as well with your healthcare provider. And that's why we're here as well. If you are feeling like, hey, I have two 16-year-olds and we're all fully vaccinated and we want to go to Disney World. Okay, go to Disney. You're doing the best that you can for yourself. Whenever you go inside, wear a mask. If you're outside, it's fine. I think that the other thing that we need to remember is what resources we have. Sometimes moms can feel really overwhelmed because they just don't know where to look for the answer. And while I am here for all of my patients, if you're like, well, I don't want to make a decision to go also to make another appointment because so-and-so has to go to school, remembering what resources we have. And so the CDC has a wonderful website, and I can give you the link to it if you want to pin it, what are the particular transmissibility, properties or, the population that is happening in different areas of the country. What are the current mask recommendations for vaccinated versus unvaccinated individuals? They have all of that information there. So you don't feel like you have to be making these tough decisions by yourself without really having any kind of information on your side. Regarding the vaccine itself, there is a wonderful vaccine education center that the Children's Hospital of Philadelphia has on their website. It not only goes through COVID, it goes through every single vaccine ingredient, the history of vaccines, all kinds of things that you would ever want to know about vaccines. So I think also, just knowing your resources and knowing, and if you don't know them, then again, you can call me, call your pediatrician, like, where should I look for this information? Because that is another part of this pandemic that is exhausting, is how much information is out there and what should I believe and what do I not believe and what's credible and what's not. And so that's another thing that you can definitely lean on your pediatrician for, is to help you figure out what resources are useful and which ones are not so useful.
Yeah. And I think that's something as moms, at least for me personally, I just kind of have to take the information that I have at the time, make the decision, and know that I'm doing the best I can with what I knew at that point. And that would be my encouragement to all moms out there. And, we're all doing our best. And obviously we want to keep all of our kids healthy and happy and all of that. So for those who might be interested in getting vaccinated, where can they go?
Yeah, so UTMB has, basically every pediatrician's office at UTMB should have available vaccines for, 5 and up. And particularly in my practice, we even have clinics on Saturdays. That's when my son got his vaccine, the 6-year-old. So yes, he is vaccinated, for those who were wondering. And then the health department, if you are not a patient of UTMB, the Galveston County Health Department should have access to the vaccine for those individuals who may not be patients. But for the most part, pediatricians' offices in general should have the vaccine.
So that's great news. It doesn't feel so much like Hunger Games like it was when our vaccine came out and we're all like
driving in the car in line. Yes.
But see, that's what I think is, while this hasn't been the most fun I've had in 20 months or 22 months, and it has been really neat to be on this point of history and medicine to see where we were just even in April with that's when I got my first vaccine. And kind of where we are now, that we are through this population. And back then, I have to say, it sounded like a pipe dream that we could have kids vaccinated by Christmas. But we're talking about it, y'all. You can have your kids vaccinated by Christmas. Any other thoughts that you would like to share with our audience?
You know, the last thing that I do want to share, as a general pediatrician, and I think as a mom, I think that I never ever recommend anything I wouldn't give my own children. And I think that is something that tends to resonate the most. Like you say, you know, I'm a numbers person, but not everybody is a numbers person. And if my doctor tells me, you know, I would give this to my child without hesitation, I think that sometimes can be really a impactful type of statement. And so I do want to share that with the audience in that, you know, my 6-year-old, he's going to be due for his second dose next weekend, and we'll be there again on the weekend as a patient. It's always really interesting to be on the other side of things in the waiting room. But yes, I never recommend anything I wouldn't give my own children, and I am counting down the days that my 4-year-old reaches her 5th birthday so that she can also be vaccinated. We are going to be heading to Disney World, hopefully, God willing, in May of next year. And I had told my husband, I said, I really don't feel comfortable traveling, really, especially in, you know, in a long flight without knowing that my 2 kiddos are vaccinated. And so that was one of the things that we had really talked about. And so we're so excited. I am a Disney fanatic, and I think I'm probably the most excited out of everybody in the whole family. But yes, I think that this is something that is so important to everyone's health as we kind of progress through this pandemic and hopefully see the end of it.
Amen. And how exciting that you get to put that on your calendar.
Yes.
Like, it's going to happen. What do they call those? Oh, the vision boards.
Yes.
On your vision board for 2022.
Well, so yeah, going to Disney is definitely on the vision board. And I am very type A. So I've already thought about like what restaurants we're going to eat at, what rides we need to do. I've heard that the new Star Wars ride is incredible. So but that is part of 2022. And then we're going to be visiting family in Iowa. My husband's family is from there. And so we'll do our summer trip up there, which will be so nice. And so, you know, I think it's just being hopeful that we get to kind of get back to our norm, whatever that new norm may be. And, you know, getting kids back to doing things that they love doing and not feeling like they have to, you know, be distanced from one another too. I think that's so important for their development. It's been hard to see the kids, you know, just almost feel comfortable with, you know, even this whole mask, you know, having to wear it, which is a necessary part of this. But hopefully we can move forward, and maybe next year I'll be able to go into my son's school on the first day and actually take him to his classroom. That's also a hopeful for 2022.
Oh, yay. I hope that for you too. We actually got to do it this year for my kids' class. And so it's been fun to be back and under a bit more restrictions, but to go have lunch with them again and try not to miss out in those opportunities. So we appreciate those of you like yourself on the front lines who are doing what you do to educate and to vaccinate our children so that we can get back to all of these activities and a brighter 2022 and then an even brighter 2023. I know some of y'all are going to have questions below. If you do, please drop them. I will make sure that the UTMB Health and professionals come back and circle around, and we'll make sure to drop all of those links that we referenced in here, how you can find a doctor at UTMB, the CDC website, CHOP, I think is what you call it, right? Children's
Children's Hospital Philadelphia.
They are an amazing heart hospital, which is how I know them too. And so we will drop all those links so you guys can have those at your fingertips. But if you have questions, sound off. We also know that vaccination can be a little bit of a trickier topic to navigate. So we ask you if you have disagreements or maybe you're just questioning, and that you do so respectfully, so that we can continue the conversation respectfully. And it's our job to just provide you the information. And we are thrilled that we were able to do that today with UTMB Health. Dr. Rodriguez Lien, thank you so much for joining us today.
Absolutely, it was my pleasure.
And again, we will start this again next year, where we are bringing you monthly health videos, and they are going to be hot topics that you're going to want to know about. So until then, we will see you in the new year. I hope you all have I can talk. Happy and safe holiday season. And we will see you in 2022 with UTMB Health. Take care.